Okay, well, welcome everyone to Gilda's Club Kansas City's acupuncture and treatment side effects class with Lindsay Perkins. And I'm going to go ahead and let her introduce herself and just welcome to the class.
Thank you. Thank you, Amy. So, I'm a licensed acupuncturist here in Kansas City, and I am at Elements Acupuncture down near Waldo area. And a little bit of background with me is I went to Bastyr University, which is a university up in Washington State, and I got my master's degree in acupuncture and oriental medicine up there. So, after that, I started my own practice up on Woodby Island, and I was there for about 4 or 5 years, and then I moved here to the city. So I'm originally from here, so it's good to be back, and that's kind of where I'm at. So thank you for having me. So I'm gonna start with acupuncture and kind of explaining it. So with acupuncture, it traditionally dates back about 3,000 years ago. They have the hieroglyphs of acupuncture and moxibustion found. They used to use bones and tortoise shells. So, not quite the ideal situation back then to get acupuncture, but it has evolved over the years, and more books and things were coming out, and ideas and points were being discovered at that time. And then we entered the Warring States period in the Han Dynasty. So more of the medical texts for acupuncture and materia medica, which is the herbal, kind of like the herbal dictionary, was created as well. And then during that time, during the Warring States period, more metal was being able to be ironed down and made more into needles. So at this time, it was kind of cool because there was a lot of war going on at the time. So there was more philosophical ideas coming out, more um, being related more towards nature. So they like looked at nature more on how it's influencing us, which is very interesting kind of concept. So in the spring, we have a lot more kind of irritability, and there's different kind of emotions that go through. And say in the summer, we get more talkative and more energy, and the sun's out. So they looked at more of the nature of what was going on as well. All right. So, how did it come to America? So, we had the popular story of James Reston. He was a reporter for President Nixon. He was visiting over in China back in the 70s, and he had to get an appendectomy. And during his time and his stay at the China and in China at the hospital, he did receive acupuncture, which helped tremendously with his symptoms. So, he kind of got the ball rolling and came back and started talking about it, and people were getting interested in it, and that's how that started to fluctuate over into the United States. And then also in the 70s, we did have the New York Lincoln Detox Center, which was people that were addicted to medication and drugs and things like that. They were using that to help with detoxing and treatments to help with symptom relief. So we'll just kind of go over this and the prevalence of acupuncture. So we have a lot of acupuncturists now. 8 out of 10 cancer hospitals have acupuncturists on staff, which is huge. It's definitely 65 to 80% of the world's population is using a traditional medicine to treat different conditions. So it is definitely becoming more mainstream and well known in throughout Asia, obviously, and then also through Europe and in the US. So this is kind of the different modality within acupuncture. So these are all things that I do within my scope of practice at Elements. And I'll go over each individual one so you can kind of understand. And I did include this picture here to show kind of how acupuncture works. So we have these meridians, all those little kind of highways. And that's how the best way I can describe it is we have these meridians, these highways that run all over through the body, and they can start on the fingers and the toes, and they go everywhere, and they pass through all kinds of different muscles and tissues and organs, and have an influence on the lymphatic system, the endocrine system, reproductive system. And this is how we access these. So how does it work? So we use very, very thin needles. I always tell my patients it's the size of a cat whisker. They're very, very small. They're one single use only. They are FDA regulated and they are sterile. So they come in individual packages as well. It's very different than a hypodermic needle that will actually inject something in. So this is not a hollow needle. It's just very small, very thin. And then also with the acupuncture, we do use electroacupuncture. So we'll hook up electrodes to the needles and apply a very small current that'll connect the two. And that can help with various different conditions, anywhere from sciatica to low back pain. It kind of depends on what's going on. And then moxa. So moxibustion is basically moxa is a Chinese form of mugwort, and what they do is they dry it, and it's this beautiful kind of gold color, and then they roll it in this kind of cigar-looking thing, and we light it on fire. It smolders kind of like a cigar, it kind of smoke, and then we put it kind of a couple inches over the acupuncture points. And I love moxa. I use this in the clinic a lot. It can help with joint pain. It can help with anxiety. It can help increase white blood cell count. I've used it on HIV patients, used it on oncology patients as well. It can definitely help with chronic fatigue. And I've been using it a lot in the office right now because everybody's so cold. So it's wonderful to help with circulation and move the body fluids. Helps with the lymphatic system to move things out. So you definitely, that's another modality that I'll use in the clinic. So then we have the herbal part. So this is another part of my degree that I had added on. And so basically we have this huge book that's about, it's huge and it has all the herbs in it and what their uses are and the properties that they do. And basically you learn the herbs and then we have these formulas, what we call formulas. So it's a combination of different herbs. It can be anywhere from 3 herbs to a dozen herbs. And I always relate it to a symphony. So basically each herb has its own part in the formula. So each instrument has a part to play the beautiful music, and that's how they have just the synergistic effect as well. And the herbal formulas have been around for thousands of years. They've been tweaked and books have been written, and they're very, very precise. So it's a little bit different than Western herbalism, where it can be sometimes they'll give for immune support or adaptogen, they'll give ashwagandha or they'll give astragalus. Whereas in Chinese medicine, it's more herbs linked together because they're all doing a certain effect on the body. And then at Elements, we do have a full herbal dispensary. So we have capsules for people that are a little bit more on the go. We can't tweak those formulas because they're more in a capsule form. And we also have a full herbal dispensary, which is granules. And granules is like taking the capsule and breaking it open. So then with that, we can tweak and add whatever herbs that we want in the dosages and make it much more tailored to an individual and the symptoms that they're experiencing, and then check in and make adjustments as needed. So that is an option, which is really wonderful. So we also do cupping. Cupping is, if you're familiar, Michael Phelps kind of made that in the know during the Olympics. He had the big circles on his back. And with those, we traditionally do fire cupping. So basically, you have the cup and you have a hemostat with a cotton ball that's lit on fire, and then you take it and it takes all the oxygen out of the cup, and then you quickly put it on the skin. It creates the suction, and so with that, it can help increase blood circulation to the area. It helps loosen the muscles and separate the fascia, and basically creates more of a micro trauma at the cellular level. And with that, it can help detox the body. So anything that's built up, inflammation or toxins in the muscle, help flush that out and then regenerate new growth. So it'll have an immune response. So then more nutrients will be added to the area where it wasn't before. It's a wonderful way to help relax the muscles. I have quite a few patients that will just add it on to their treatments because most of us are sitting at the computer now during COVID and kind of tightening up a bit and not stretching. So muscles get really tight as we're sitting more right now. So gua sha is a tool, and basically you scrape and rub the skin, and that will help cause more. It stimulates an anti-inflammatory response and the immune response, similar to cupping, but not quite as with cupping. It's pulling on the muscle. With the gua sha, it's more scraping through the superficial layer, and it'll help definitely increase blood circulation. I definitely help try to relax muscles that are kind of more hard to get areas like the neck. The neck is really good to use with gua sha to get in those hard areas. And that will definitely cause some redness, but it typically only lasts for a few minutes and then the body kind of it'll dissipate after a bit. But gua sha is a wonderful way to help with the inflammatory response to help relax muscles as well. And then we have Qigong, which is more of a mindfulness practice. It's used heavily in martial arts. And if anybody's taken a Tai Chi class, then they'll probably definitely go over a Qigong work, which is where you feel more of the energy in your body and you just link it with your breath as well. And there's certain postures that you do to help open things up. I always think of Qigong as more of a self care for yourself, more of a mind body connection for yourself. So I have patients that, if they're experiencing a lot of insomnia or if they're experiencing a lot of stress and anxiety, then I'll have them do certain breath work and certain postures in order to help relieve some of that stress. And it kind of supplements what I'm doing with acupuncture when they come in to visit on their time that they're not seeing me. So, kind of look at it from a Western standpoint. How does acupuncture work? So, it definitely can help release those endogenous morphine, like the endogenous or endorphin. So, that's like the body's natural painkiller as well. And it helps regulate the ATP and adenosine factors as well, which can help regulate heart rhythm, the circulatory system, the endocrine system, also help increase the fibroblast activity, which helps decrease the inflammation, which is why acupuncture is so known for, is helping with pain for sure. It helps release those endogenous opioids, which is our natural painkillers, and then also decrease that inflammation and help flush it out through the lymphatic system as well. So this is another part I kind of explained in the very beginning, but from a Western standpoint, it definitely helps work and stimulate the sensory afferent nerves. So we have our nervous system, and with the nervous system, we have the autonomic nervous system, and with that, we have the sympathetic nervous system and the parasympathetic nervous system. Sympathetic nervous system is our fight or flight. So when we get stressed, we want to book it and run, or we want to fight, right? And with the parasympathetic nervous system, that's our rest and digest. And acupuncture helps regulate both of those. So it helps decrease that fight or flight stance and let the body relax more. So that's why it has such a wonderful effect on stress and insomnia and different stressors in the body, which also cause the tension in muscles and things that will generate pain and illness later on. So now I'll start with the Eastern medicine and the co-treatment for cancer. So these are kind of just it's kind of a guideline or a list that some of the side effects from chemo and radiation that acupuncture can help with. So we do have nausea and vomiting. We do have the fatigue and the appetite. So sometimes there'll be more of a decrease in appetite. Start getting some hot flashes. Peripheral neuropathy is definitely a big one. Anxiety and depression. So a lot of oncology patients, they're very nervous, and sometimes the the chemo can really ramp up that sympathetic nervous system. So acupuncture will help relax that. The xerostomia, that will help with that dry mouth, help with the fluid regulation with the lymphatic system and the endocrine system, and help with that edema as well. And so there's just kind of another acupuncture can do so much. So it's kind of have like a laundry list of everything that it can help. So also help in healing sores. It does help harmonize that immune system to help calm it down a bit. Or if we need to improve the platelet count, we can definitely work on that as well. And energy, just like I said, the moxa and the acupuncture can definitely help. And I do go over diet a lot because there's certain foods from a Chinese medicine standpoint that I'll look at and say, okay, try incorporate, these lists of foods into your diet. They'll help increase certain amount like of blood or energy in the body. All right. So with these, you can kind of read over these. It helps improve mental alertness and decrease swelling. Also improves that circulation, regulates the urination, shortens that recovery time so you're not suffering as much during that chemo time, right? Afterwards. Okay, so when you go see an acupuncturist at Elements, we have it more organized where we talk about your goals, your main concerns during your first visits, 90-minute visit. So basically that allows us a full intake of what's going on with you, kind of get an idea of how your body works. Everybody has their own kind of constitution, and with that it's more, some people run more warm, some people run more cold, and just kind of get a general sense. Some people are more vulnerable to their digestion being a little wonky than others, or others have more of a lung problem because they have asthma. So we get a good health history of what's going on with you, and that way we can figure out goals for you on what you really want to focus on, what you want relief from, and then give you a treatment and see how you respond after several. And then we always keep, you know sometimes things change. So some people come in first and then they're working on one thing and they're like, whoa, well, thanks for, I didn't even complain about my digestion, but now, it's actually better, and that wasn't even their chief complaint of why they were coming in. So acupuncture can really help with an array of symptoms that are going on at the same time, because the diagnosis is much different than Western medicine. So this is kind of a treatment schedule. It depends. We definitely do it based off of the patient as well. Definitely like about 48 to 24 hours before they start their treatment to come in to kind of help build the body back up. And then they can come in after they've, or during their radiation treatments and things, in order to help, balance the body back from the side effects that's going on with that radiation or that chemo going in the body. So this was just a European Journal of Integrative Medicine. So there was like like basically um, a retroactive study that took place. It was 89,000 patients. So we had 93% of respondents that actually were successful at treating their primary complaint that they were having. So acupuncture definitely it can help a lot of different people in a high response to improving their symptoms as well. Okay, and I kind of went over that I went and got my master's. This is kind of just here for you to look at. As acupuncturists, we do have a master's program. It's 3 to 4 years, and it does include the pharmacology, herbology. When I went to Bastyr, it was heavily Western science geared as well, along with the Asian medicine. And then afterwards, I did travel to China and I studied in Shanghai and Chengdu. And during the master's program, I did shifts at Harborview Medical Center, which is the level 1 trauma center in Seattle. And I did different shifts on working with HIV patients. I worked with refugees at the International Clinic. And I also worked with chronic fatigue as well. So definitely have more of a well-rounded clinical side, as well as traveling abroad and experiencing the hospitals over in China. And they've really integrated Eastern and Western medicine over there. It's really nice to see. And then after, you take 4 national board exams, which are really strenuous and stressful, and then you pass those, and then you apply for your state license. And then if you're not too overwhelmed with student loans, then you can go get your doctorate. So that's kind of that's how how acupuncturists will get their degrees. And so it's pretty strenuous. It can be a really stressful program. And but yeah, here we are. All right. Those are the sources that I was just citing. And then I just want to thank you. I want to thank everybody for coming, and thank everybody for listening to me online. And if you have any questions, please feel free to reach out. I'm at Elements Acupuncture, and I will be happy to talk with you and answer any questions you have.